Okay, what's up everybody? Welcome to my YouTube channel. My name is Grace Anyango. I'm a registered nurse, and in this channel we're going to discuss all the conditions in mental health according to DSM-5. So on my previous video we talked about neurodevelopmental disorders, and one of the examples that I gave was intellectual developmental disorder. So when we talk about intellectual developmental disorder, what do we mean? Basically, intellectual developmental disorder is characterized by deficits in social functioning, problem solving, judgment, abstract thinking, and managing age-appropriate activities. So when we talk about social functioning, what do we mean? When we talk about social functioning, we basically mean impairment in communication, regulation of emotions, and language interpretation. That is what we mean when we talk about social functioning and managing age-appropriate activities. What do we mean by that? When we talk about managing age-appropriate activities, then we mean that one or the child is not able to do activities like bathing, taking themselves to the toilet, and feeding themselves. And what are the causes of intellectual developmental disorders? The causes are may not be easy to detect, but one of the causes is any interference during pregnancy. That is when any interference during pregnancy. That is when the mother is on drugs or taking alcohol or malnutrition or any infections to the mother when she is pregnant. Another one is problems during birth, e.g. when the child is deprived from oxygen during the process of delivery. Another one is injury to the head or infection, e.g. meningitis, whooping cough, severe head injury, near drowning, and infections in the brain. Another condition that may cause, or another cause of intellectual developmental disorder, is any interference in normal development of the brain, e.g. Down syndrome or genetic conditions. And one of the causes that basically all the doctors or specialists always detect is idiopathic, meaning you can't really tell what was the cause of this condition of intellectual developmental disorder. You can't really tell what was the genesis of the whole thing. So how do you diagnose intellectual developmental disorder? Before you diagnose, there are three main criteria that you need to have before you decide that this child or this person has intellectual developmental disorder. One of the things is problem solving and abstract thinking. So this child basically has a problem in judgment, academic learning, and learning from experience. That is basically what we mean when we say problem solving and abstract thinking. Another one is deficit in adaptive functioning, and that results in failure to meet developmental and sociocultural standards. And this may cause deficits in personal independence and social responsibility. Okay, so the diagnosis is always in four major stages. That is mild, moderate, severe, and profound. Okay, when the child has mild IDD, that is, there's no obvious difference between this child and the rest of the children in their age. So they may have difficulty learning, but with the appropriate help, they may catch up with the rest of the students in their class or who are within their age bracket. Now, and again, another sign of when a child has mild IDD is they may have problem regulating their emotions. You see, when you don't expect a 7-year-old child to cry like a 1-year-old baby or raising tantrums. So at the age of 6 or at the age of 5, there is a way a child should regulate their emotions and how they should react to the things that happen around them. And how do we classify when the child has moderate IDD? The child is very much behind, is markedly behind compared to their peers. That is when their skills, their language, and pre-academic activities develop a bit slower than the rest of the students. And individuals can care for their personal needs, but that is when it comes to eating, dressing, and hygiene. But from time to time, this individual might need help from their caregivers or family members, and most of the time you'll need to remind them, like, you need to do this, and you also need to do that. When do we tell when a person has severe IDD? So when a person has severe IDD, attainment of social skill is limited. Basically, they're very much behind. Probably when it comes to speaking or social interactions, they are very much behind in managing age-appropriate activities. They might not be able to without the help of a caregiver. So basically, they need to be reminded and they need to be helped. One of the activities that they may take part in is very light activities, like removing their plates from the table and taking them to the kitchen. Or when you ask them to sweep, they can do that. But without extensive care, they might not be able to attain these skills when needed. And they cannot make responsible decisions regarding their well-being or participating in tasks, many of the tasks at home and at work. Okay, so for them to acquire these skills, there is need for ongoing help and ongoing teaching for them to be able to acquire these skills. And despite all the ongoing teaching and help, they will always need someone to always be there with them to remind them that this and that needs to be done this way or the other way. So, and the last category is the profound category. Basically, when you are profound, then the conceptual skills generally involve physical world rather than this patient or this child would interact with the world with signs rather than words. Most of the time, when they need something, they prefer using, like, they need a cup, they'll have to point at the cup for you to get it, because their communication, their speech, everything is lagging behind. Their motor skills, everything about this person is way behind compared to the rest of them, of their peers, or basically people in their age bracket. So they have limited understanding when it comes to their communication and some sort of things. So basically, these people will always have someone there with them to help them when it comes to communication. So basically, people who have profound IDD will use more of non-verbal communication than verbal communication. And when they use verbal communication, then then that will be one word. When they need a cup, they won't say like I need a cup. They'll rather say cup, because they can't make a complete sentence, and they can't make a complete sentence regarding to their need. They'd rather use one word or the non-verbal communication. Okay, so in other aspects of their daily-to-day life, then they'll need like a lot of help for them to catch up with the rest of their peers, and most of the time they might not be able to catch up with the rest of their peers. So when you notice that someone has deficit in social skills, academic functioning, problem solving, abstract thinking, compared to their peers, or in a certain age group, then it is appropriate for a parent or a guardian to seek help from a professional, and for their kid to get the kind of help that they need. So that is all for today, and tomorrow or in our next video we'll have to learn about another condition that will be communication disorders, which is quite large, but I hope this video is helpful. So if you have any question, you can ask on the comment section, and or if you have any addition, you can also put in the comment section, and we will be tackling all these conditions one by one in their deeper context, and we'll touch on everything, and we will also make other videos on how the caregivers and parents will be able to manage their kids or take care of their kids during this period of their life, because this condition can be very difficult for the caregivers and their parents as well, because the child or the patient will be very expensive, because they'll need a lot of care both at home and at school. So that is it for today's video, and I hope I'm very helpful. I'll try to make notes on this and share with you guys, so that you can get to know these things into deep, instead of going to a whole 1,000-page DSM-5. So I'm able to summarize them for you and give them to you. So thank you for your time, and you make sure you like, comment, share, and most importantly subscribe for more videos. And as we continue, we'll continue being much better, and we'll cover more of these conditions. So bye, and see you in the next video.